This medication is made up of a mix of aspirin, acetaminophen, and caffeine. It is used to temporarily relieve pain from conditions such as muscle aches, toothaches, menstrual cramps, or headaches, including migraines. Aspirin and acetaminophen work by preventing your body from producing certain natural substances that cause pain. Caffeine helps to enhance the effects of aspirin and acetaminophen. The recommended dosage for adults is usually 2 tablets every 4 to 6 hours as needed, with a maximum of 8 tablets in a 24-hour period. It is best to take this medication as soon as you feel a migraine coming on for the most effective relief. If you are using the over-the-counter product for migraine relief, make sure to read all the directions on the package before taking the medication. If you have any questions, consult your pharmacist. If your doctor has prescribed this medication, take it as directed. Take this medication by mouth as directed by your doctor, or follow the product package directions. Drink a full glass of water with this medication unless your doctor directs you otherwise. If you are using the tablet form, do not lie down for at least 10 minutes after taking this drug. If upset stomach occurs, you may take it with food or milk. The dosage is based on your medical condition and response to treatment. Do not increase your dose or use this drug more often or for longer than directed. Do not use this product for pain lasting longer than 10 days or fever lasting more than 3 days. Use the smallest effective dose. If you are taking this drug as needed, remember to use it as soon as you feel the first signs of pain. If you are taking this product for headache, seek medical help right away. If you also have trouble speaking, weakness on one side of the body, sudden vision changes. Consult your doctor or pharmacist if your migraine headache is not relieved, or if it worsens after the first dose. If you are using drugs for migraine attacks on 10 or more days each month, the drugs may actually make your headaches worse. Do not use medications more often or for longer than directed. Tell your doctor if you need to use this medication more often, or if the medication is not working as well, or if your headaches get worse. Consult your doctor if your condition lasts or gets worse. Some common side effects of this medication may include nausea, vomiting, stomach upset, trouble falling asleep, or a shaky/nervous feeling. If these effects persist or worsen, it's important to notify your doctor or pharmacist. It's important to remember that if your doctor has prescribed this medication to you, they have determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. However, it's crucial to stop taking this medication and notify your doctor immediately if you experience any serious side effects such as severe or persistent stomach/abdominal pain, severe dizziness, fainting, vomit that looks like coffee grounds, black or bloody stools, ringing in the ears, loss of hearing, irregular or fast heartbeat, signs of kidney problems, or easy bruising/bleeding. While a serious allergic reaction to this drug is rare, it's important to seek medical help right away if you notice any symptoms such as fever, swollen lymph nodes, rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed above. It's important to note that in the US, you can call your doctor for medical advice about side effects or report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects or report side effects to Health Canada at 1-866-234-2345. One of the ingredients in this migraine relief product is acetaminophen. It's important to not take more than 4,000 milligrams, 4 grams, of acetaminophen a day, as taking too much may cause serious liver disease. If you have liver problems or are giving it to children, you should take less and ask your doctor or pharmacist for guidance. It's crucial to check all your medications for acetaminophen and to not take it with any other drugs containing acetaminophen without consulting your doctor or pharmacist first. If you take too much acetaminophen, seek medical help immediately, even if you feel well, as overdose symptoms may include nausea, vomiting, loss of appetite, sweating, stomach/abdominal pain, extreme tiredness, yellowing eyes/skin, and dark urine. Finally, daily alcohol use, especially when combined with acetaminophen, may harm your liver, so it's best to avoid alcohol while taking this medication. Before taking this medication, it's important to discuss with your doctor or pharmacist if you have any allergies to aspirin, other NSAIDs, salicylates, acetaminophen or caffeine, or if you have any other allergies. It's also important to talk about your medical history, especially if you have asthma, certain blood disorders, bleeding or blood clotting problems, ulcers, gout, kidney or liver disease, nasal polyps, anxiety disorders, insomnia, heart disease, high blood pressure, or stomach problems. If you are planning to have surgery or certain medical procedures, make sure to inform your doctor or dentist about your medication use. It's also important to avoid daily use of alcohol and tobacco, as it may increase the risk of stomach bleeding. Older adults may be more sensitive to the side effects of this medication, especially stomach/intestinal bleeding and ulcers, liver problems, and trouble falling asleep. Children and teenagers less than 18 years old should not use aspirin or aspirin-related medications without consulting a doctor first, as it may lead to a rare but serious illness known as Reye syndrome. If you are a woman of childbearing age, it's important to discuss the benefits and risks of using this medication with your doctor. This medication may harm an unborn baby and cause problems with normal labor/delivery. It is not recommended for use in pregnancy from 20 weeks until delivery. If your doctor decides that you need to use this medication between 20 and 30 weeks of pregnancy, you should use the lowest effective dose for the shortest possible time. It's also important to consult your doctor before breastfeeding, as this medication may have undesirable effects on a nursing infant. Before taking this medication, make sure to inform your doctor and pharmacist about all the products you use, including prescription/non-prescription drugs and herbal products. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this drug are acetazolamide, cimetidine, corticosteroids, such as prednisone, dichlorphenamide, ketoconazole, levoketoconazole, methotrexate, mifepristone, certain medications for gout, such as probenecid, sulfenpyrazone, and anti-seizure drugs, such as phenytoin, valproic acid. Also, consult your doctor before using this product if you have recently received certain live vaccines, such as varicella vaccine, influenza intranasal vaccine. This medication may increase the risk of bleeding when taken with other drugs that also may cause bleeding, such as antiplatelet drugs and blood thinners. Check all prescription and non-prescription medicine labels carefully since many contain pain relievers/fever reducers, and if taken together with this product, may increase your risk for side effects. However, if your doctor has directed you to take low-dose aspirin for heart attack or stroke prevention, you should continue taking it unless your doctor instructs you otherwise. Lastly, this medication may interfere with certain lab tests, possibly causing false test results. Make sure lab personnel and all your doctors know you use this drug. If someone has taken too much of this medication and is experiencing severe symptoms such as passing out or difficulty breathing, it is important to call 911 immediately. Otherwise, contact a poison control center for further assistance. In the U.S., residents can call their local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Overdose symptoms may include nausea, vomiting, loss of appetite, sweating, burning pain in the throat and stomach, stomach pain, extreme tiredness, yellowing of the eyes or skin, ringing in the ears, rapid or shallow breathing, irregular heartbeat, changes in the amount or color of urine, confusion, agitation, seizures, or loss of consciousness. It is important to seek medical help immediately if any of these symptoms occur. Always follow the recommended dosage and seek medical advice regarding the best time to take this medication for migraine relief. It's important not to share this medication with others. If you use this medication regularly for a long time or at high doses, your doctor may want to do some lab and/or medical tests to check your liver and kidney function. It's important to keep all medical and lab appointments and consult your doctor for more details. Since this product contains caffeine, it's best to avoid taking it close to bedtime to avoid trouble falling asleep. It's also a good idea to limit the use of caffeine-containing medications, foods, or beverages while taking this product to avoid becoming nervous or irritable, having trouble sleeping, or having a fast heartbeat. If you are taking this product for headaches, it's best to avoid certain foods that may trigger your headaches. Making lifestyle changes such as stress reduction programs, exercise, and dietary changes may also help prevent headaches. Be sure to talk to your doctor or pharmacist about lifestyle changes that might benefit you. If you forget to take this medication and it's almost time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take a double dose to make up for the missed one. Make sure to store this medication at room temperature, away from light and moisture, and don't keep it in the bathroom. Keep it out of reach of children and pets. When it's time to get rid of the medication, don't flush it down the toilet or pour it into a drain. Instead, talk to your pharmacist or local waste disposal company about the best way to properly dispose of it when it's expired or no longer needed. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.